In this lecture, we are going to discuss the concepts of prevention, different types of prevention, and the control of diseases. The main functions of doctors, as we mentioned previously, is the promotion of health to prevent the establishment of risk factors and the prevention of illness by health education or by protection and restoration of health of the patients. As a doctor, we are not only concerning about the treatment of a disease, but always to promote health and maintain the health and protect the health of the population. In addition, it is one of the most important one is elevation of suffering. It is important always to deal with the relief of pain of suffering individuals. As a disease, it has two phases, which include first the pre-pathogenesis. That means there are risk factors, but there are no pathological changes in the tissue. The second stage is the pathogenesis. That means the starting of the effect of the risk factor on the different parts of the tissue and start changes and development of diseases. Disease prevention defined as first activities designed to protect patients or other members of the public from actual or potential health threats and their harmful consequences. So it is any activity which are used by doctors or health workers in order to protect the patient or the public from any harm or threats, such as infection or other risk factors. Or it may be defined as the action aimed at eradicating, eliminating, or minimizing the impact of disease and disability. Determinants of prevention. If we wish to have a successful prevention, so it is important first to acknowledge the causation. What are the causes of the disease? And then what are the way of a transmission or mode of a transmission, and identification of the risk factor and risk group. What are the risk factor for certain diseases and what are the risky group? Also, it is important that there should be a prophylactic or early detection and the treatment measures in order to prevent the disease. Also, an organization for applying these measures to appropriate person or groups, and also continuous evaluation and development of procedures applied. So if we want, for example, to prevent, for example, non-communicable disease such as the cardiovascular disease, so it should be important to know what are the causes, what are the risk factors, what are the mode of transmission, or mainly it is by different method of occurrence of the disease, and what are the prophylactic, and is it possible to for early detection, are there available method for the diagnosis, and can we modify the prognosis of the disease by application of certain measures such as alteration of lifestyle of the individual, changing the diet or physical activity, or having aspirin, for example, prophylactic drugs, stop smoking. So if these procedures are available or if it is affordable, so it is possible to make such preventive measures. There are four levels of prevention, such as primordial prevention, primary prevention, secondary prevention, and tertiary prevention. And each type of prevention, it should be applied at certain stage of the disease development. So, for the primordial prevention, it should be applied before the occurrence or establishment of the risk factor, and this is mostly by, as we mentioned previously, by health promotion. So, we always educate people to modify their diet or their lifestyle in order to prevent the establishment of the risk factor. While the primary prevention, it is applied on individual they have risk factor, but it is possible to stop the occurrence of the disease by modification of the risk factor by certain procedure or activities. And the secondary prevention, it can be applied for individuals who have already starting the pathological changes in the tissue, but still they are preclinical or they are asymptomatic. So we can apply the secondary prevention by screening and early detection, and then we are going to modify the natural history of the disease by certain preventive measures. Lastly, the tertiary prevention, it is applied on patients who already have the disease and they have signs and symptoms, and it include mostly the treatment and rehabilitation and decrease the disability. So for the primordial prevention, as we mentioned, this is a prevention of development of the risk factors in a population group which they have not yet appeared. So a special attention is given in preventing the chronic disease or the communicable disease. Main interventions is health education, and this effort are dedicated towards or discouraging people from adopting harmful lifestyle habits and through individual and mass education. So mainly for the primordial prevention is it is directed for individuals before the establishment or to prevent the establishment of risk factor, mainly by health education, and we have already discussed this by health promotion and health education in order to change the lifestyle in order as early as possible to prevent the occurrence of the risk factor. For example, as smoking, it is one of the risk factor for the development of coronary heart disease, and it has been stated by many studies that the changes started in the arteries as early, the atherosclerosis as early as the age of 16 years. So it is important to establish health education program for school children in order to stop or to prevent the establishment of the smoking, and in order to prevent any changes or early changes in the arteries. Primordial prevention, a relatively new concept, and it is receiving special attention in the prevention of chronic diseases. Many adults have a problem such as obesity or hypertension have their early origin in childhood. So because this is the time when lifestyles are formed, such as smoking, as we mentioned, eating pattern or eating habit, and physical exercise. So it is important to establish healthy lifestyle as early as possible to prevent the establishment of the risk factors. Primordial prevention begins in childhood when health risk behavior begins. So parents, teachers and peer groups are important in imparting health education to the children. So mothers and school teachers and friends and family members, they are all involved in the establishment of primordial prevention by health education and the prevention of the development of the risk factors. Example of primordial prevention include national program and policies on food and nutrition. So many governments or at many states they establish certain policies for the establishment of some policies for the prevention of or establishment of the of risk factor. For example, in some countries they prevent the putting the salt on the dining table. So the individual they are not added. They will not add the salt. There is no salt to be added for the extra salt for the food, and this will decrease the risk of hypertension, for example. Modification of the nutrition. Healthy diet, it can be established as early as possible in order to have healthy habits or healthy food habits. Comprehensive policies for discourage smoking, alcohol, and drugs by establishment of educational program as early as in the school at school age. So and explaining the side effects of this material, so it will discourage people from smoking or taking a drug abuse. To promote regular physical activity, it is important to establish there certain physical activities in schools in order to teach children to perform this activity as one of the important factors to get use even in the school or at houses. Making major changes in lifestyle. It is important to modify the diet at home, for example, in order to prevent the occurrence of the risk factors. The second type of prevention is the primary prevention. Primary prevention can be defined as the action taken prior to the onset of the disease, as we mentioned, although which remove the possibility that the disease will ever occur. And this action are taken before the onset of the disease. So among individuals who have a risk factor, but the disease was not established yet. It signifies interventions in the pre-pathogenesis phase of the disease or the health problem. So there are risk factors, but it is still not affect the pathological effect on the tissue. So it is important for early detection to stop the effect of the risk factor on the tissue. It includes the concept of positive health, a concept that encourages achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. So it is important to establish a positive health concept for people as early as possible. So there are two types of methods to achieve the primary prevention. First, by health promotion or by specific protection. Example on the health promotion, which we have already discussed, is by health education. Health education should be involved in different levels or different aspects of life or different stages of life according to the program which we are going to establish. Environmental modification. It is important to provide safe water supply and or proper sewage disposal, and this is mainly by governmental procedure or governmental policies to prevent the bad effect of polluted water. Nutritional interventions, as we mentioned, as early as possible, change the eating habit at a family level, at a school level. There are many schools especially in the developed countries. They provide a healthy school meal for the pupils or students. This will to promote and they used to eat the healthy food. Also, there are some nurseries or some schools they advise children or prevent the children from consumption of some of the unhealthy food. Lifestyle and behavioral changes should be started as early as possible, as it is mentioned previously, while specific protection mainly by immunization and seroprophylaxis. Immunization, it is one of the most important aspects in the prevention of infectious diseases, and it has tremendous changes in the mortality and morbidity among children and all over the world by establishment of the immunizational schedule in all over the world globally. And as you know, the immunization, which is either active immunization or passive immunization by giving the immunoglobulin or seroprophylaxis for some individual in certain conditions. Chemoprophylaxis is by providing some drugs. The chemoprophylaxis, they are drugs which they are administered for people who have no disease, but to protect them from having or developing the disease in the future. For example, administration of some drugs such as anti-malaria drugs, they are administered for patients who are traveling to malaria endemic area. So they will give the anti-malaria pre, during, and post. Prior to their trip, during the trip, and 2 weeks after they return from the endemic area. This will prevent the infection with malaria, and there are large number of prophylactic or prophylaxis. The use of specific nutrients or supplements. For example, the administration of folic acid or for ferrous or ferrofolic capsule for pregnant women during pregnancy to prevent the occurrence of anemia for the mother. Safety of drugs and foods. It is important to have a safe drug or food and control of environmental hazards such as air pollution by taking a special procedure to protect the pollution of the air by different pollutant. It is always taken by different governments. There are two approaches for the primary prevention according to the World Health Organization. First, population approach or strategy or high risk strategy. The population strategy, it means that we are going to apply the primary prevention for all the people in the country. So all the people, the procedure is directed for all the population, for the whole population, irrespective whether the individual have high risk or no. For example, studies have shown that even a small reduction in the average of a blood pressure or serum cholesterol of a population would produce a large reduction in the incidence of cardiovascular diseases. That means if we apply certain primary preventive procedure, for example, detection of certain risk factor among people as a whole for cardiovascular diseases. So this will contribute in the reduction in the incidence of cardiovascular disease. So the population approach is directed toward socio-economic, behavioral, and lifestyle changes. So according to the type of the disease which we are going to prevent. The major advantage of population strategy is that one does not have to identify the high risk group, but simply aims to reduce the level of a given risk factor for the whole population. No need for identification of the highly risk group or group with high risk factors, so it is applied for whole population, such as iodization of salt with the addition of salt to the of iodine to salt and iodide to salt, or the fluoridation of water. So the main disadvantage is that it offers little benefit to many individuals because their absolute risk of disease are quite low. So some people who have no risk factor or the risk factor for this is low, they will not benefit from this strategy. For example, most people will wear seat belt. We always advise people to wear seat belt to decrease the risk of the trauma for if they are exposed to crash or car accident. But some people, they never have this accident, so the benefit from this procedure is very low. But the people who have frequent accident, they will benefit from this policy. So this phenomena has been called as prevention paradox. Prevention paradox means that some individual who have no high risk, but they have also the preventive strategy, but they will not benefit from this procedure. High risk strategy, on the other hand, the high risk strategy, it means that we are going to concentrate on the individual who have risk factor. For example, there is family history for colon cancer, and there is some studies stated that the colon cancer can be familial. So it is important to screen for colon cancer for individuals who have positive family history, and they can perform frequent checking in order for early detection of the disease. And the same example is for breast cancer. Women who have positive history or family history for breast cancer, it is important to have frequent screening or check in order to early detection and to change or modify the risk factor. But this requires detection of individual at high risk by the optimum use of clinical methods or different biochemical or microbiological procedures. Primary prevention is a holistic approach which relies on the measure taken to promote health. So, although the high risk individual strategy, which aims to protect only the susceptible people or persons who have the risk factor, so is most efficient for these people at greatest risk of specific diseases. So these people may contribute little to the overall burden of the disease or the population. However, if people with established disease are included in this high risk people group, so the strategy will contribute more to the overall reduction in the burden of disease. So the main disadvantage of the high risk group high risk strategy is that it usually requires a screening program to identify the high risk group, something that is sometimes it is difficult and it is costly. So these are the differences between the two strategies, whether the population strategy or the high risk strategy. So the main advantages of population strategy, it is regarded as radical, so large potential for all the population, but behaviorally it is inappropriate. While the disadvantage, it have a small benefit to individuals, and maybe it have poor motivation for subjects, especially if they have no risk factor. Also, it is poor motivated by physician because they think maybe it is wasting of time sometimes, and benefit to the risk ratio may be very low because the benefit is less than the risk, because some people they don't have risk. While for the high risk strategy, the main advantages are appropriate to individuals. Individuals, especially who have family history or who have risk factors, it is important for them. They will be more highly motivated to have these preventive measures to decrease the risk of development of the disease and the prevention or modification of the course of the disease or the natural history of the disease. And also with the physician, they are highly motivated, and here is the benefit to the risk ratio is favorable and it is high. While the disadvantage of the high risk strategy, it need high screening cost. It is costly. Especially there are some screening tests, they are very costly, and costly not only in terms of financial, but it is costly regarding the it need a team, and it need long time consuming in order, and in addition to the financial aspect, it have a temporary effect, and it is a limited effect and behaviorally inappropriate. Modes of intervention for the primary prevention, as we mentioned, health promotion and the specific protection, which have already discussed previously. Specific protection is for directed toward protection against specific diseases, for example, or the provision of conditions for normal mental, physical, and functioning of the human beings and in groups, and it include the promotion of health, prevention of sickness, and care of individuals, which have been already discussed. Intervention by immunization, as we mentioned, use of specific nutrients, chemoprophylaxis, as we mentioned, protection against occupational hazard. For example, some people who are working in a construction or high places, so they should wear the helmet in order to decrease the risk of head trauma if they have a fall, for example, and also the use of eye protection, special glasses for those who are working in the welding jobs to protect the eyes from any injuries or effect. Also, the protection against accidents, as we mentioned, such as the by health education and control of general environment, avoidance of allergens, and etc. The use of specific immunization, as we mentioned, for the BCG, DPT, and MMR, which we have already mentioned. Chemoprophylaxis, against, as we mentioned, against malaria, or tetracycline for cholera, for the individuals who are in contact with patients with cholera, or in the epidemic of cholera, we can administrate tetracycline for the people to prevent the occurrence of the disease. The use of specific nutrients such as vitamin D or vitamin A for individuals, or iron and folic acid tablet for the pregnant women during pregnancy to prevent the development of anemia. Protection against accidents such as we mentioned, the use of helmet or the seat belt, protection against occupational hazard, avoidance of allergies, and protection from pollution. The secondary prevention is it is defined as an action which halts the progress or prevent the progress of the disease and its incipient stage, and prevents complication. So there are certain interventions which are applied or action before the occurrence of the disease, when the individual they have the risk factor but they don't have they not develop the disease yet. So the specific intervention include early diagnosis, for example screening test, for example screening for visual screening for children in the preschool, for their vision and for their hearing, or breast self-examination, frequent periodic breast self-examination for women who have family history, or pap smear, as we mentioned, for cervical cancer in women, and radiographic examination and treatment for individual who have, for example, in contact with the tuberculosis. Also, we can establish the treatment, or after the screening test, we are going to refer the individual to doctor for confirmation of the diagnosis. So secondary prevention attempts to arrest the pathological changes of the disease and restore the health by seeking out unrecognized disease and treating before the irreversible pathological changes take place, and reverse the communicability of infectious disease. So the secondary prevention is applied at a stage before the development of the disease. So that means we are going to modify the disease natural history of the disease, or arrest the pathological changes by application of certain treatment or referral of the individual for confirmation of the disease. It protects other in the community from acquiring the infection for communicable disease. So this will decrease the risk of the transmission of the infection and prevent the occurrence of the disease. The main objectives of the secondary prevention: first, complete cure and prevent the progression of the disease process. We are going to modify the natural history of the disease or the chain of the disease by early detection and early intervention. To prevent for communicable disease, we are going to prevent or stop the spread of the disease by curing all non-cases. To prevent the complications and the sequelae of the disease, to shorten the period of disability. Early diagnosis of the disease, it means that the disease complication can be prevented and health can be restored by diagnosing the disease and at its early stages. That is by providing the adequate treatment according to the health problem, such as arresting or stop the disease process, restore the health of the individual, treat the disease before irreversible changes, pathological changes occur, and reverse the communicability of the infectious disease. So early diagnosed, it means that better prognosis. That means you are going to arrest the occurrence, or the pathological changes should be stopped. So it is directed at the period between the onset of the disease and the normal time of the diagnosis, and it aims to reduce the prevalence of the disease. Secondary prevention can be applied only to diseases in which the natural history includes an early period and when it is easily identified. So it is important to apply it at a stage where the disease can be stopped in the preclinical stages. The two main requirements for useful secondary prevention program are a safe and accurate method of detecting of the disease, preferably at a preclinical stage, and effective method of intervention. When we want to prevent the disease or apply the secondary prevention by screening, so there should be availability of accurate and safe screening tests. There should be available according to our resources. In addition, there should be treatment available, because it is for the sake of the patient. When we diagnose that the individual he have a disease before the appearance of clinical sign and symptom, it is important to have or stop the disease by establishing certain or effective intervention or method of treatment. For example, screening for cervical cancer provides an example of the importance of secondary prevention. Studies supported the value of such screening program, which are now widely applied in many developed countries. So the application of pap smear for women at a special age group, especially for those women who are sexually active women, they should have the frequent pap smear for the human papillomavirus, and to see if there are any cervical changes or erosion which are regarded as pre-malignant. And so it is regarded as one of important screening tests in the developed countries to decrease the risk of development of cervical cancer. So other examples of secondary prevention measures, there are large number of examples. For example, testing of eyesight or vision and hearing in the school children. Preschool entry assessment of the vision and the hearing and the IQ to assess the vision and hearing to assure that the individual will have a good academic performance. Also, screening for high blood pressure in middle age. Blood pressure, it is one of what is called the silent diseases. Sometimes most of the individual, they don't have sign and symptom of the disease, and sometimes the patient presented in the latest stage after the development of complication. So it is important to screen blood pressure or examine the blood pressure for individual periodically for early detection, especially individual who have family history of cardiovascular diseases. Another example, testing for hearing loss in factory workers. There are some factories or individual, for example, working in the industries which have high noise or sounds. For example, individual working at the airport or the aircraft, or in the working at the ships. So they have high voice or noise, so that this will affect the hearing. So it is important to examine the worker periodically for early detection of deafness or changes in the hearing ability. Skin testing and chest radiograph for diagnosis of tuberculosis. In many developing countries where there is high incidence and the prevalence of tuberculosis, so it is important to have it should be prevented by the BCG. But in some countries, they still have some individuals who have no vaccination. So it is important to periodic examination of MAN2 test for detection of or tuberculin test for detection of individuals who are susceptible for tuberculosis or diagnosis of tuberculosis. Tertiary prevention, it is used when the disease has already established and there are pathological changes and the individual have sign and symptoms. So it is defined as all measures available to reduce or limit the impairments or decrease the disability or the handicap for individual who have the disease, and adjustment to the irremediable condition. So for individual who already have the disease, he have sign and symptom. So it is important to establish yearly management, continuous treatment, continuous follow-up in order to limit the impairment and disability for the individual and adjust his organs to normal physiological activities. So interventions that include in the tertiary treatment is treatment, either medical treatment or surgical treatment or the rehabilitation by the physiotherapy. The tertiary prevention is aimed at reducing the progress or complication of established disease, and it is an important aspect of therapeutic and rehabilitation medicine. It consists of measures intended to reduce disability or impairment. First, reduce impairment and disabilities, minimize suffering of the patient caused by the disease, promote patient's adjustment to an incurable condition. Tertiary prevention is often difficult to separate from treatment, since the treatment of a chronic disease have the central aim of prevention or recurrence. So this scheme shows you the different types of prevention at different stages of the disease and the underlying cause. So it is just the elaboration or illustration of what we have already discussed. It is important to differentiate between disease, impairment, disability, and handicap. These terms are usually frequently used by doctors, but it is important to differentiate between these terms. We mentioned at the level of the tertiary prevention, we have the disease, and it is important to limit or decrease the impairment, and then decrease the disability, then decrease the handicap. So what are the differences between these terms? So the impairment, it means that any loss or abnormality in the psychological, physiological, or anatomical structure or function. So if the individual have any of these abnormalities, whether in the anatomy, such as the amputation of the foot, for example, in diabetic patients. So that means there are abnormal structure. So the individual will develop disability if he have impairment. Disability means that the inability to carry out certain activities because of the impairment that are considered normal for the age or sex. For example, the individual who have lost or amputation of the foot, so he cannot walk. So that means because of the impairment, because of the foot amputation, so he cannot perform the activities which where he was usually do, such as the walking, for example. If the individual have disability, so some disability may develop into handicap. By the handicap, it means that the inability to discharge the obligation required of him and play the role accepted of him in the society. So if the individual, because of the disability, he cannot perform the social role or social activities, he will have the handicap. For example, if he lost his foot, he has amputation of the foot or the limb, so he cannot walk. He only by using assistive devices. So because of this, sometimes he may lose his employment, especially if he need such as some important activities in his employment for walking, example, or climbing, or something like that. So he will have early retirement and he will be unemployed. So this will affect his social activities and social condition. So more elaboration of this term, this ability to prevent or halt the transition of disease process from impairment and handicap. Impairment, any loss of or abnormality of the psychological, as we mentioned, and physiological or anatomic structure, as we mentioned, and disability, any restriction or lack of ability to perform activity, as we mentioned previously, and the handicap, when he is unable to perform some social role. And the same example the same example can be applied for individual who have coronary heart disease. If he has coronary heart disease, so the pathological changes or anatomical changes is due to the infarction which occur in the coronary arteries, which lead to infarction in the muscle of the heart. So this will affect the anatomy and the physiology of the heart. So of the muscle, so the individual will have disability because he sometimes he have difficulty in breathing. He have inability to perform some activities such as climbing or climbing the stair, for example, or go in high altitude places, or he cannot perform some of his work, homework, or employment at his work. And this will make him unable to go to the work, for example, and he is unable to perform some of his work, so he, because of the impairment and disability, so sometimes also he will have an early retirement. So he will be unemployed, and this will affect his socio-economic condition, familial condition, psychological problem resulted from the early retirement. Individual who have certain diseases such as stroke, for example. If the individual have stroke, he have the disability, the impairment, disability, and the handicap, so he should restore some of the muscle activity by having physiotherapy, for example. So they should have certain physiotherapy in order to restore some function of the muscles. So it requires cooperation from different sections of the societies. Example of rehabilitation, for example, establishing schools for the blind, exercises for neurological disorders such as I mentioned in the CVA. For example, establishment for schools for the blind. There are certain programs for children who are blind, who have blindness, or who are blind. So by this time, there are certain mobiles, certain computers, certain iPads which are established for individuals who are blind. Also exercises in neurological disorder, as we mentioned, for rehabilitation for individuals who have stroke, an example, or prosthetic restoration or loss of tooth. Individual who have a problem with his teeth, or are tooth by application of denture, or having an extra prosthetic items, or reconstructive surgery in leprosy. Any individual who have any disfigurement because of burn, for example, or for leprosy. Leprosy, it is one of the communicable diseases which cause loss of the hands or the parts which are affected by the disease. So there are so they will have reconstructive surgery or plastic surgery in order to restore the tissue. Also, another example such as changes of the profession for a more suitable one, and modification of life in general in case of tuberculosis, and so on. And thank you.